We treat patients with chronic lymphocytic leukemia, or CLL, with so-called BCR inhibitors that inhibit BCR signaling pathway. And what happens in these patients is that they experience transient lymphocytosis after the initiation of therapy, and this is because of the inhibition of recirculation of CLL cells from peripheral blood to lymphatic tissue, and also they mobilize the cells from lymphatic tissue to peripheral blood. And this lymphocytosis induced by BCR inhibitors take usually months to resolve. And our hypothesis was to describe the mechanisms of adaptations that CLL cells use in order to survive these first months of BCR inhibitor therapy. And we've shown that BCR inhibition leads to regulation and higher activity of transcription factor FoxO1 that leads to induction of expression of Rictor. And Rictor is an essential assembly protein and also essential for function of protein complex mTORC2 that directly phosphorylates and activates AKT, which is an important pro-survival molecule. And we see that higher level or induced levels of phospho-AKT during BCR inhibitor therapy leads to longer and higher lymphocytosis of CLL patients treated with ibrutinib in vivo, and this is higher than the patients that downregulated phospho-AKT. Furthermore, these cells are highly sensitive to AKT inhibition, and we think that we hypothesize that this AKT activation promotes survival of CLL cells during BCR inhibitor therapy. And we can block this adaptation mechanism to BCR inhibition by using FoxO1 inhibitor that induces apoptosis in CLL cells, and also it inhibits proliferation of CLL cells induced by T cell factors.